Can you talk a little bit more about your writing and your speaking? We've been talking about just being a CRA, but there's other things that you're doing in this field.
I always tell people that clinical research CRA role has been such a springboard for so many reasons. And, you can stay a CRA, and I'm going to tie this into your question. You can stay a CRA and be a CRA forever, and that's great. Love your job, set in your ways. I did one CRA role for 11 years because I loved it. And every minute I loved it. I've always been a writer ever since I was a little girl, creative writer. And probably about 2007, I thought, I want to try to write an article for a clinical research publication. And I thought, well, I can, I did technical writing and the article got published. It was the ACRP Monitor. I had gathered a lot of information and knowledge from being a CRA, and I knew how to write a little bit. Of course, it got a lot of edits, but that's okay because I got published, right? And then I started writing for CenterWatch, and I sent my writing samples to the editor-in-chief at the time of CenterWatch, and she said, what I joke is I say I professionally and nicely stalked her, but I really didn't. I just kept emailing her, hey, did you read my writing samples? And I can equate that to what people need to do. You need to be persistent when you're looking for a position as a CRA. And the editor-in-chief said, you are a good writer. What would you like to write a column for us? But she said, technical writing is great, but people like real life. So at that moment, I was able to intersect my scientific and my creative writing abilities to write real stories about my life on the road. And I've had the opportunity to write articles, and articles lead to presentations. And I tried speaking at an ACRP conference, and I went from not being very good to feeling comfortable. So the CRA role has helped me just do so many different things. And it would not have been possible without this field. Absolutely not.
And you're a great writer, by the way. And if anyone wants to sample Elizabeth's writing, just go to clinicalresearchfasttrack.com. That's our website. And click on the blog section, and you can see 2 recent articles that she wrote. One was about working as a CRA. Another, your first SIV.